Welcome to the AANMC webinar. Today we are going to be covering a number of different things with us, but we've got with us Dr. Jennifer Botwick on tips for eating mindfully. I am Dr. Joanne Yanez. I'm the Executive Director for the AANMC, and we're so happy that you were able to join with us today. So with that, I'm going to turn it over to Dr. Botwick. She's a licensed naturopathic doctor in the state of Connecticut, and Dr. Botwick she's maintained a private practice in Woodbridge as an adjunct professor at the Department of Public Health at Southern California State University. She recently retired as clinical supervisor and adjunct faculty from the University of Bridgeport School of Naturopathic Medicine and continues to teach mindfulness to teens and adult learners. So I am really excited. Mindfulness is a close topic to my own heart. And so with that, Dr. Botwick, I turn the webinar over to you and just let us know when you need to advance the slides. Thank you for joining us today.
Thank you for inviting me. Hello, everyone. So mindfulness is also very close to my heart. I love practicing it. You know, they say you have to teach what you know or teach what you need to know. And of course, eating is something that we all have to do. And to do so mindfully and consciously is something that's important for me personally and professionally, as many of my patients really are asking for help in this place. So I just wanted to make one slight correction. I teach at Southern Connecticut State University. You had mentioned Southern California, which really sounds nice about now with the weather. But
my apologies on that. Southern
That's okay.
Connecticut.
That's okay. Maybe you're trying to send me there, which is fine. But that's where I'm an adjunct professor in the Department of Public Health, and I have the privilege of teaching weight management, stress management, and wellness. And you know, the undergraduates are also, no pun intended, very hungry for this information. So I'm happy to share that. So we can move on to the next slide. And so this is just showing an amalgam of the things that I've done. So yes, I'm in private practice in Woodbridge, Connecticut after working in integrative medical centers upon graduation in 2003, working with medical doctors, physical therapists, massage therapists, and chiropractic. And I still am very respectful for all those professions, but happy to have my own space where, in addition to my skills and expertise as a naturopathic doctor, I incorporate my skills as a healing arts practitioner, doing massage therapy for over 30 years, cranial sacral therapy, Reiki, and acupuncture. Next slide, please. So one of the things that's a mainstay of this presentation is our ability to stay focused. So one of the things is understanding all the challenges that we have in our world today that might keep us from doing so, especially in many aspects of our life. You know, can you just read a book? Can you just watch a TV program? Can you just fold the laundry? But of course, for our presentation purposes today, how do we focus so that we can eat mindfully? And this is not just about weight loss, as many people come to, well, how can I lose weight? Because eating mindfully for many people is getting enough calories. We have a poverty of calories in many parts of the world. So eating mindfully has a whole different gestalt, if you will. I did want to say that part of how I came to this work is that many years ago when I was a teenager, I suffered terribly from migraines and went to many different specialists to try and resolve the pain. And long story short, after many typical tests and medications, I met someone at the time who was outwardly, I guess you'd say, a gastroenterologist, but he had just come from Harvard, where there was a breakthrough new book by Herbert Benson called The Relaxation Response. And this was in 1974. And he motivated me and helped me understand the relationship between how I felt, what I ate, and what I felt and how it affected what I ate. So here we are in 2019, and that was the seed of so many groundbreaking books and approaches we know now as mindfulness. How do we connect what we do and think and feel, and how does it affect how we eat? So the where, what, why, how, and whom we eat with really affects our ability to be conscious when we eat. There's a confusing amount of info out there right now of, various diets, vegan, ketotarian, paleo, omnivore, vegan, vegetarian. And I have many patients who are confused, and it is confusing. What do you eat, how, and when? And so we're not going to get into the benefits and pros and cons of each, because there are. But again, coming back to how do we stay focused with what we're eating? So as we look at this slide, it's a pretty clear juxtaposition of eating while looking at our phone, and then someone just sitting with their tea. So what does this tell us? It tells us that when we are distracted, we may not pay attention to what we eat. So we might eat more, or we might not chew as thoroughly. And if there's something on that text that's disturbing to us, well, now we're pumping cortisol and more acid. And so whatever it is we're eating, however healthy it is, could have a negative benefit to us. And so for you, the listeners, I like to advise people to try to just do one thing. So when you're eating, is to focus on what's before you. And the woman in the slide actually has it right in that she has an actual dish and an actual fork. And some people find it funny. I say, well, when you eat, set a table for yourself with real china and real silverware and wine glasses and so on and so forth, so that the whole experience is saying, I'm going to focus now and eat and be thankful. And that leads us over to the picture of the woman with the cup. And you could see just by her face, like she's in the moment with that tea and there's nothing else happening. And this is something that I urge everyone to do, so that we bring consciousness to whatever it is that we're eating. And in many traditions, many religious and spiritual traditions, there are prayers that people say before they eat in order to bring consciousness to who brought the food, who grew the food, giving thanks. And we know in the mindfulness contemplative care world that having gratitude is very, very important. Next slide, please. Excuse me. So I have here a simple case study, a 36-year-old female who has chronic migraines, severe anxiety, and what we call disordered eating of anorexia. And the labs on this woman were totally normal. But what we found over time with this particular case study is that the physicality of the person and the person's inability to have one place to eat, so scattered eating in the actual physical sense became a disordered eating within her body habitus. And we also discovered that through body work, specifically cranial sacral therapy, that when we were able to focus in on the muscle spasms of the jaw, the neck, and her scalp, that it released a considerable amount of headache tension and therefore affected her behavior. And with that, we also promoted her to seek a counselor, specifically a behavior therapist who specialized in disordered eating. Next slide, please. So why naturopathic medicine? Healthy isn't a goal, it's a way of living. Another way of saying, it's not the destination, it's the trip. And this is so important. It's very intelligent, naturopathic medicine, in that we are legitimizing the necessity of having a healthy approach to living, which of course involves eating and sleeping, healthy relationships, laughter, play. So it's important to understand the protocols or the tenets, if you will, of naturopathic medicine, doing no harm and having doctor be teacher, which I am and absolutely love being able to share and facilitate and motivate people in their choices. Because when we have disordered eating, answering the questions means asking the right questions. What is it about what's going on in your life that might affect what's happening? Is there an underlying hunger or anger or fear or loneliness or depression? Is there a schedule that affects your ability to eat? How much? Maybe never. Um, where do you eat is a very important aspect of the integrative elements of looking at what we're doing and focusing. You always eating standing up, by a television screen? Do you sit at a table, as I said before, with actual place settings? This really affects how we physically and metaphorically digest our food. And it's in the how and the where and the when and the whys can color, if you will, the what's. So, what are you eating? Are you a junk food eater? Are you an emotional eater? And so you have certain snacks for certain emotions. Do you just have liquids as your food of choice? What is it that you're eating? So together, this influences all of our choices. And none of it could happen without our consciousness and our awareness of our decisions. And that's having a approach that isn't alone. We know that social isolation plays a huge impact on people's ability to live long and healthy lives. And so having a naturopathic doctor, having a behavioral therapist, so that we can understand our awareness or lack thereof of our ability to make healthy food choices. Another thing I wanted to say about this is that it's very interesting that we are 3 times more likely to eat the first foods that we see. So this is really important for all of you listeners to just give a thought to how is your food displayed in your house, on your cabinets, on your counters. Um, this really influences what happens. So that classic opening the refrigerator door, like, I think I want to eat something. Um, are the containers clear? Are they opaque? Is it disordered within the refrigerator? So you're like, oh, I don't know, I'll just take this. So this incredible statistics about that whatever we do serve ourselves from what the first foods we see, that 92% of what we serve ourselves is whatever we take. So this is where the idea of changing your portion size, if you're someone who's trying to work with calorie restriction or weight loss, to have smaller plates and sizes and things so that we don't feel that we're in denial. Our plate is full, it's just smaller. And along with this, it's also really important that once you serve yourself, get out of the kitchen. That we know that the more we tend to lounge and schmooze in the kitchen, that more foods are eaten. So that when you are socializing, although it's very tempting and we all love to hang out in people's kitchens, it's better for our ordered and conscious eating to socialize somewhere other than our kitchen. Next slide, please. So planting the seeds of a healthy future. What does a healthy future look like for you and our planet? So this is just really front burner, really important right now. Unless you're living under a rock, you know that our planet is in a serious health crisis, and we can make an impact on our choices of what we eat. And this can help our what I call home, our body, our internal landscape, and also can have an impact on what our planet can look like in the very near future and in the distant future. So this is where some of the variety of diets might be confusing for you. Um, and without going into benefits of meat eating or veganism, we do know the fact of how much effort it takes to raise a cow with the amount of water and feed. And so, uh, without it being locked in stone, it is advisable for your own health and for the health of our planet to have a very strong diet as a plant-based protocol. And so playing with this can be fun and exciting and colorful, and you can include everyone in your family to do this so that basically it's moving things around so that you can enjoy what you eat and have variety, but also know that you're making really conscious, healthy decisions for you and the planet. And just some suggestions about that is that for helping people in their feeling good when they eat, and especially if you're driven by cravings, what we want to do is prevent you from having any blood sugar dipping. So it's recommended, and again, there are individual changes to this, but generally speaking, eating every 2.5 to 3 hours, snacking on macronutrients, the proteins and the fat and the carbs. So for example, yogurt with nuts if you're a dairy eater, string cheese with brown rice crackers, having nuts and carrots. So it's eating, but it's more than just the nutrients, but it's a balance for your blood sugar, which is interesting because when we lower our blood sugar, we have increased stress and we have more anxiety and confusion, a sense of overwhelm. So we don't make the best decisions. So if you're concerned about your consciousness and what you're doing with your eating, you want to help your blood sugar from dipping. So therefore you decrease your stress and you decrease your anxiety and your confusion. And we all make much better choices in all aspects of our life when we're feeling centered and grounded. Next slide, please. Oh, that's my contact information, but can wrap up shortly. I did want to mention that in this program, that the title being Tips on Eating Mindfully, that there are a plethora of tapes and apps and books that can help us with our ability to be mindful. And mindful is just another word for being present and having consciousness and being aware in the present moment. And when we bring that to anything we do, and specifically in conscious eating, then we are able to be aware and increase our joy and our ability to pay attention. So that helps us when we're eating to notice, oh, well, this food isn't as fresh as I thought, or, the anticipation was great, but now that I'm here with this item, I really don't want it. And so it's paying attention to ourselves and knowing that we can integrate what we need with conscious and enjoyable eating. And that's it.
Dr. Botwick, thank you so very much. As you were speaking, I had a memory of a talk that I went to a bunch of years ago that spoke, in addition to some of the factors you mentioned about eating, that spoke about the groceries that we buy and how we consume within 2 days the majority of things that we bought in a grocery visit. And how important it is, if you are trying to make more mindful choices, to not bring foods home. It kind of, sounds like a no-brainer, but don't bring foods home that you don't want to eat. And so, and if you do, they will be gone in about 2 days. But the even more interesting factor is the things that don't get eaten in 2 days end up sitting on your shelves for a few months.
Mm-hmm. Yeah, it's so interesting you say this because for my pediatric patients who have a terrible diet, I look to their parents and I say, well, they don't go shopping. A 3-year-old doesn't get in the car and go shopping. I say, so it's really up to the parents to make better food choices. And so you're absolutely right. If we want to be more mindful, and you bring up a really good point, is we go into the store and we're super hungry, our chances of buying things on impulse to satisfy that empty leg, as I call it, are much greater.
No, absolutely. And I think, one of the mindfulness exercises that I've used myself, and I also will and have taught with patients is, when you're making a choice, I think of health on a continuum. And so, the choices that we make every day can either move us in the direction of our goals or away from our goals. And it's a conscious decision that we can make when we're looking at a food or making a grocery buy or at a restaurant and looking at a menu, and ask yourself just for a second, is this choice going to move me toward my goal or away from my goal? And if the answer is away from your goal, then you need to say to yourself, am I okay with moving away from my goals just this once and maybe having a cheat day? Or no, I'm not okay with moving away from my goals. And that, rather than, like you said, being an emotional response or a response out of hunger or low blood sugar, it's a conscious decision.
Right. And again, that's so fueled by, if we have low blood sugar, it's really hard to think straight if you are devoid and deficient of really important nutrients. So it's, it is part of the continuum. And I do like to seg that for many of my patients, having goals sometimes get in the way. So we hold it lightly with this idea of it's a similar idea, but having their intention. And somehow that gives them a little more permission when they're not ready to just have an outright, like, okay, I'm not going to eat X, Y, and Z. But if they say, I'm going to hold it lightly, there's some psychological aspect of us that allows there to be a little more play, because, disordered eating has a lot of emotional challenges to it. And so getting to those subtexts takes a qualified amount of time and therapy. And while we're doing that, to encourage, whether it's someone, for example, who has anorexia or bulimia, how can they eat? They have to eat, but to do so with a lot of self-love and forgiveness. And this is a really important aspect of this part of what we call unconscious eating. And so all of it is part of a very important continuum, unlike cigarettes or tobacco or liquor, although some people might disagree. You do not need that to survive. But eating, is a little bit trickier.
Yeah, it is. So before we go and start to take questions and answers,
Mhm.
Amy, can you go to the next slide real quick? And thank you so much. So the upcoming AANMC events that we have. So on March 6th, AANMC is hosting Naturopathic Medical Virtual Fair. And this is really a great opportunity for folks who are curious about naturopathic medical education, maybe thinking about this as a career. It's a really easy way for you from your home for no cost to be able to visit with all of the schools. Each one of the member schools will be present, and they'll have admissions counselors as well as current students and advisors. And I know what we've heard from attendees from past fairs is they really value the opportunity to speak with current students, especially, and understand what it's like to be an ND student. Next month, we're also offering a webinar on polycystic ovarian syndrome, and so we hope that you can join us for some of our upcoming events. So with that, Dr. Botwick, I'm going to start to take some questions.
All
So
right.
the first one is, what resources do you recommend for those interested in learning more about mindful eating?
Well, it's a combination of books about mindfulness. One that is a very good foundational book is called Full Catastrophe Living, which is a Bible, if you will, of mindfulness, written by the person I call the father of mindfulness, John Kabat-Zinn. Some of you may know Dr. Zinn started a clinic about mindfulness for people with chronic pain up at Harvard about 30 years ago. And the reason I think this book is an important beginning, because he explains at the very most important basic levels of what mindfulness is and how to do that, and has many, many exercises within the book. So I think that's a good book. And it has an associative workbook with it and CD. So if you're someone who likes to journal, which has been proven to be very effective with conscious eating and eating disorders, those might be good tools for you.
Thank you. So the next question, there are a couple questions coming in now. Can you explain some of the differences that occur physiologically when you sit down to eat in a mindful manner versus eating rushed, or eating in an emotional state, or eating under stress or in your car, and maybe just some of the physiological differences that occur. I know you briefly talked about cortisol and stress hormones and the impacts on digestion, but could you go into that in a little bit more detail, please?
Sure. So, I'm going to make it very general, but when we eat or do anything that is in a stress response, and I'll call it distress as opposed to eustress, so positive versus negative, when we are more negatively stressed, spewing more stomach acid and cortisol, get a cascade of events going on in our body. And in fact, just to refer back to the Kabat-Zinn book, there's some great graphs in there and body maps that show, what goes on in the body when we're stressed. And if we look to our digestion, which is really super connected with our brain, this gut-brain connection, there is just incredible feedback. Think of it as your body under threat, that fight or flight. And so as your whole system is feeling stressed, even though you might be needing to eat, but you're feeling stressed, it's emotionally, maybe you have a lot of pain, your body is doing what it can. It's a most primitive place in our primitive brain to protect us. And so really we need our energy, simply put, in our limbs so we can run. So we don't have as many of the benefits for the important hormones being at the level of our intestines and guts because our body's feeling a threat and is just spewing and ready to go elsewhere. So when we can sit in a less harried and less hurried way, we increase some of the dopamine, we increase some of the serotonin, the oxytocin, which really benefit us and they help us with our stress responses. So being mindful before you sit down, or if you're the person cooking all along the way, it's really important to think about that. When we do that in our own family, we try not to cook when we're angry and certainly serve it and eat it when we're angry has a whole different effect on everyone than if it's done in a loving, conscious way. So hopefully that helps.
Thank you. And speaking about, conscious imagery while we're eating, there was a question that came in from someone who is a weightlifter, a bodybuilder, and
Hmm.
food, the thought and imagery around food fueling and rebuilding muscles. Any comments on some of your favorite uh, imageries or, guided imageries or visualizations that you like to use with folks for more mindful eating practices?
Oh wow, there's like a gazillion. It's so individual. So I would say the simplest, if you're a beginner at this, first of all, determining if you're someone that reacts well with an image that helps you relax. So for many people, water is very beneficial, and I think of the waves coming in and coming out. So there's a rhythm. So for some people, having a counting helps them to de-stress, thinking about the ocean with its rhythm. For some people, it's just imagining their favorite happy place on earth, real or imagined. And so again, right away, our gut brain, oh, I'm in that place. And it's amazing what happens physiologically. Um, there are many that are written, many that you can listen to and purchase, whether it's YouTube or iPhone, and reading. But I would say the best success is really knowing yourself and who you are. Do you do well with listening or imagining, um, seeing, and then find that and support yourself in that way.
Thank you so very much. So I'm looking and I'm not seeing any additional questions. Those of you who have any additional questions, please feel free to type them in quickly. But Dr. Botwick, I really appreciate your time. This is something that I think is so important, as we have a culture of sitting and, looking at our phones and reading emails while we eat. And, Lord knows I am not always perfect on this realm either. One of the things that always struck me when I went to Europe especially in vehicles and rental cars, is most of the time, rental cars in Europe don't have cup holders. And, at first as an American, I'm like, what do you mean a car doesn't have a cup holder? But then I realized, like, because you're not supposed to be drinking coffee on the go. You're supposed to sit at a cafe and,
Exactly.
enjoy the moment, and preferably share that with some friends. And, it isn't, food is really a vehicle to keeping us sustained, but it also can be something enjoyable. And I think that, that component has somewhat been lost in our hustle
Oh,
and bustle rush of, culture here in North America. And so, I've always found that as an interesting thing. Dr. Botwick, you just got a little note here from Brian Krause, who said that it
mhm.
was nice to hear your voice.
Hi,
But
Brian.
yeah. So, but other than that, I'm not seeing any additional questions, and so I can stay on the line for a little bit for those of you who have attended and have any additional questions. But Dr. Botwick, thank you so very much for your thoughtfulness on mindfulness, and we really appreciate your presentation.
Thank you so much for having me, and I'm happy to answer any additional questions and talk to people about this. It's really a subject that I love learning more about and instilling in my own life. So thank you very, very much.
All right. Well, that concludes our webinar today. Like I said, I'll be hanging around for a little bit if you have any additional questions. Otherwise, we'll see you next month at our virtual fair and our PCOS webinar.